I made a video last week talking about how a 2-year-old boy is unable to sit, stand, control his neck, or even walk just because he had jaundice when he was a week old. The mother thought everything was fine, unknown to her that the jaundice had already affected the boy's brain. So when they expected him to sit and achieve all other milestones, he had delays in them. After I made the video, I got questions like what are the causes of jaundice and the prevention of jaundice. So I'm here to talk about the causes of jaundice. Jaundice can be divided broadly into two groups. We have physiological jaundice and non-physiological jaundice, which is also called pathological jaundice. You see, this physiological jaundice is just because of the immaturity of the liver. It's not a big deal. Even without treatment, physiological jaundice will go on its own after 7 to 10 days in a term baby, and in a preterm baby it could take 14 days. The jaundice is as a result of the immaturity of your baby's liver. The baby's liver is not yet mature enough to get rid of bilirubin. Bilirubin is what causes jaundice. As baby spends days on it, as baby grows, the liver gets matured and it's able to get rid of bilirubin. So to people who feel pawpaw water, pawpaw leaves, glucose, and all other things like that worked for their baby when their baby had jaundice, I'm here to tell you that you only felt it worked because your baby had physiological jaundice, which would even go on its own without any treatment. If it is pathological jaundice, it will not go. You would need to take the baby to the hospital. Now let me talk about non-physiological jaundice or pathological jaundice. There are several things that can cause this non-physiological jaundice, but I'll just talk about the common ones. Number one is ABO incompatibility. What do I mean by ABO incompatibility? If you're an O positive mother, these antibodies would fight against A positive blood and B positive blood. So when you have a baby that is A positive or B positive, these antibodies you have in your blood would fight against this A positive or B positive blood in your baby. And because of that, it would affect your baby's red blood cells. Because of the death of the red blood cells, excess bilirubin would be produced, and this excess bilirubin will not be able to get excreted by your baby's liver, causing jaundice. At this point, you would need to take the baby to the hospital for phototherapy or for exchange blood transfusion. It's usually mined if the baby is A positive, but if the baby is B positive, it's been known or it's been shown to be more severe. The only thing you need to do is the moment it is noticed that your baby has jaundice, if it is noticed in the hospital, wait for the treatment to be done before you go home. Or if you've been discharged home before you notice this, take your baby back to the hospital and let him be treated properly. Number two is RH incompatibility. The RH incompatibility simply means the mother is negative, A negative, B negative, O negative, or whatever negative it is. The mother is negative and she's carrying a baby that is positive. First baby is always paired, like the first pregnancy, the baby is paired, nothing happens to the baby will be very fine. But during delivery, in the process of delivery, or maybe during pregnancy, there could be a mixture of the mother's blood and the baby's blood. So the moment the mother is exposed to the baby's blood, which is positive, the mother would produce antibodies. Antibodies are capable of destroying any positive blood. But at that time, the baby is already delivered, so nothing will happen to the baby. But the second pregnancy, if this mother, after first delivery, if the mother did not take the injection called anti-D immunoglobulin, which is popularly called Rogam, that is why if you are negative, they would give you Rogam after delivery. This is to prevent the formation of these antibodies. So if the mother did not take that injection Rogam after the delivery of the first baby, that means these antibodies would be produced, and the moment they are produced, there is nothing you can do to unproduce them. They are already produced. So subsequent pregnancy, as mother is getting pregnant like this, if the baby is positive, these antibodies will go ahead to destroy the baby's blood cells. It's always very, very severe. The baby will become severely anemic, and when they give birth to them, they will have this serious jaundice. At that time, the only thing that can be done is exchange transfusion. So I'm here to tell all mothers, if you are O negative, if you are any negative, A, B, or O negative, please, after delivery, ensure you take this Rogam injection. This is a mother that is negative carrying a positive baby, and you can see how the antibodies are trying to enter the baby's blood to destroy the red cells. Number three is a particular deficiency called G6PD deficiency. You don't need the name. This G6PD is just an enzyme, and what does it do? It protects your baby's blood cells. So when a baby is deficient in this, when you expose them to some things, it will lead to the destruction of the red cells. Let me tell you the examples of some of the things that can destroy your baby's red cells when they are deficient in this enzyme I just mentioned. Number one is camphor. Don't expose your babies to camphor. Camphor can destroy their red cells, especially if they are deficient in this enzyme I mentioned. Don't expose your babies to camphor. Camphor, Cafura, they are called naphthalene balls, most balls. Don't expose your babies to these things. Then some drugs, some antimalarials like primaquine can also affect your babies. Even infection can destroy your baby's blood when they are deficient in G6PD. So now let's talk about other causes. Infections, hepatitis. This is why I'm saying all mothers should take hepatitis vaccine. I already made a video on that. Please go and get your hepatitis vaccine. Don't affect your babies. If you have hepatitis, there's a possibility that the baby will get hepatitis as well, and this can affect the baby's liver. When the liver is affected, the liver will not be able to excrete bilirubin, which would cause jaundice.